Yeah. Well, so I think the most common thing we might hear is the difference between navicular syndrome and navicular disease, and that's what's commonly used.
Mm,
So if you say something like the horse has navicular changes, that's usually evidence of on radiographs, you see changes to the navicular bone. It could be enthesiopathy, like there's some spurring on the sides of the bone.
mm,
It could be something like cyst or degeneration. It could be flexor cortex damage. There's a whole lot of things that we can see on the navicular bone. It could be like these little lollipop cysts.
mm,
And so when you have those changes, a lot of times a horse will be labeled as having navicular disease. But if a horse, well, let's back up a little bit. To diagnose this, a vet would come out and perform a lameness evaluation. And if a horse is, head bobbing lame on a front limb, the most common thing they would do is then perform a palmar digital nerve block,
mhm,
make sure that that lameness is coming from the foot. And the palmar digital nerve block numbs the back half of the foot, a little bit of the, or back half of the foot, a lot of the sole actually. And if the horse becomes sound when that area is numb, then they say, okay, the pain is most likely coming from the heel. So then they take radiographs, and horses that don't have any changes on radiographs are often said to have navicular syndrome, and horses that do have changes are said to have navicular disease.
mm,
But the more that we've studied navicular, the more we realize that it's sort of a misnomer because, and actually, there's been a bigger push recently to change the name. We went through a phase of where it was called like caudal hoof pain.
mm,
Now, a lot of the more podiatry focused veterinarians are saying things like podotrochular disease because
mm,
it's that apparatus in the back half of the foot. Really, the presence of changes in the navicular bone doesn't determine soundness. There's a lot of
mm.
horses that have navicular bone damage that are perfectly sound, and there's horses that have no damage to the navicular bone that just struggle and struggle and struggle to get comfortable.
Mm.
And so Dr. James Rooney in 1974 was performing all these dissections and looking at biomechanics, and he realized that in his study, there had never been a case of navicular bone damage that didn't have corresponding soft tissue damage, but he found thousands of horses that had soft tissue damage for the deep digital flexor tendon or collateral ligaments of the navicular bone. And so his hypothesis was that the soft tissue damage happens first. And then because of that inflammation, the bone changes. So a lot of times if you see these horses that are diagnosed with navicular syndrome, in my experience, it could be something as simple as like, oh, they have thrush. Like they have a really
Mm,
bad case of thrush, their frog's really hurting, they have pain coming from their heel area.
mhm,
Or something like, oh, hey, they have a DDFT tear or a collateral ligament tear
mm.
or an impar ligament tear. And if you ignore that and just think like, oh, it's just this navicular syndrome, it's not so bad yet, that's when it can progress and start to cause more significant changes because it's not allowing that injury to heal. Sorry, that's kind of a longer answer.
No, no, very interesting. Yeah, it's funny. I had a thoroughbred and she's now retired in one of my fields, but she had what was referred to as lateral collateral ligament inflammation of the coffin bone, which I'm like, oh, interesting. Because the bone itself didn't have any problems, but the surrounding soft tissue was problematic. And now she's retired. But went sound after Butte was a magical thing. Um, what makes a horse a candidate for you to either go out and start seeing them or to actually be a resident at your rehab?